Well, thank you so much. I was so excited during the introductions. It seems we have a group that spans all the way from New York down to Georgia, Alabama, and then on the West Coast, I'm here in California. We have some people up in Washington and Chicago. So I'm just really amazed that, we're really covering all across the United States tonight. And I'm really excited to be speaking with this group. Um, Tonight I'll be talking to you about, this idea of COVID-19 or coronavirus when it comes to long-term care. And I'll be giving you kind of an example of one community's approach for preventing COVID-19 in nursing homes. And I'll be talking mostly about our local experience here in Orange County, California. So thank you so much for the introduction, and I'll go ahead and get started. All right. What I hope to achieve tonight is one, why nursing homes? Why is this such an important population when it comes to infectious diseases and especially coronavirus? And then I'll be talking a bit more about, what are we doing here in Orange County when it comes to preventing infections for nursing homes? And I'll give you a little bit of the backstory of some of the work we had been doing, in the years prior to this whole pandemic, and then how we've kind of used our experience to focus on COVID-19. And then what I hope we could all take away is, what could we learn from this? And so I'll end my talk with some takeaways, what we've learned by working with nursing homes, and even some prevention strategies that we could all be using in our everyday life to keep safe. Okay. So I always like to start by looking at some numbers. And are you able to see sorry, I know I have my picture on the side here. Okay. So I always like by looking at the numbers. So here in the United States, the Centers for Disease Control, or the CDC, estimates that 1.3 million Americans live in nursing homes. And there's about 16,000 skilled nursing facilities here in the United States. And CDC estimates that between 1 to 3 million serious infections occur in nursing homes each year. And when it comes to this population, there's really almost every imaginable risk factor when it comes to having severe outcomes due to infection. So you're dealing with a population that tends to be older age, have many chronic conditions. Nursing homes provide, custodial residential care for many older adults. And they also provide skilled nursing care for people living with chronic conditions and disabilities that require assistance with their, usual activities of daily living, anything from dressing and bathing, eating, and those, our usual daily activities. So this is what we consider, and in public health, we think of as, an especially vulnerable population. And this certainly holds true when it comes to coronavirus or COVID-19. And looking at this was a headline from New York Times just from early last week. More than 1/3 of the US coronavirus deaths are linked to nursing homes. And this includes both the residents or the patients that are cared for at the nursing homes, as well as the healthcare workers that provide the care for them. So as of early last week, nursing homes, between their residents and their staff, represent 5%, or 1 in 20, of all of the cases of COVID-19 here in the US. And this amounts to over 1.2 million cases. And although nursing homes only represent 5% of the total cases, they represent 34% of the deaths here in the United States. So this is already over 150,000 people, nursing home residents, nursing home healthcare workers, who have died due to COVID-19. So because of this, this is, a really high risk population that we're especially concerned about, and deserves a lot of attention when we think about strategies for prevention. And this has gained attention not only in the news media or places like New York Times, but also among all the major medical journals and medical societies. So lots of other headlines, from our high up journals, the New England Journal of Medicine, the Journal of the Medical Association. Nursing home care is in crisis. And basically, like many aspects of healthcare, this pandemic has kind of unearthed all of these underlying issues, but definitely bringing a lot of attention to the needs and the importance of nursing homes and what could be done to support this very important care setting. So for the next part of my talk, I'm going to go into a little bit of a specific example of what we've been doing here in Orange County, California, leading up to the pandemic, and then, when it comes to addressing COVID-19. So to give you kind of a case study of what's been happening here in Orange County. And for those of you who are not familiar, Orange County is shown here in this, orange color. We're in Southern California. We're right below Los Angeles County. We're right above San Diego County. We're actually the sixth most populous county in the United States. We have a population of just over 3 million people. And we have 70 nursing homes, which are shown with these green dots here in the map of our county, and many acute care hospitals, which are shown here in blue. And in the years leading up to this pandemic, I've been working here at UC Irvine for the last 5 years. I work with a physician named Dr. Susan Huang, who's been here for several decades. And there's been a lot of what I want to talk about is kind of how we were, I think, uniquely prepared to address COVID-19 because of the community partnerships we had when it comes to studying infectious diseases, and specifically healthcare associated infections, which are infections that occur in hospitals, in nursing homes, basically infections that are occurring in places where people are receiving healthcare. So here in Orange County, we had been inspired by work that was put out by the Centers for Disease Control and Prevention, or CDC, which really conveyed this idea that infectious diseases are contagious. We know that germs can spread between patients and across healthcare facilities as patients are, transferred back and forth. So basically what this had told us is, any one hospital can do amazing infection prevention, or one facility could have the best protocols in place. But if their neighbor that's sending them patients doesn't have those same protocols in place, it really conveys this idea that we all have to be in this together. Germs don't care about where you're coming from. They spread so easily. So because of this, working together is vital. And what this report from CDC was showing is that, we really need a coordinated approach between hospitals, between nursing homes, between the public health departments within a region, because in order to tackle something like a contagious germ, whether it's a bacteria, a fungus, or a virus like the virus that causes the coronavirus disease, patients are safer when facilities work together. And what they found is that more people get infections when facilities are not working together. And as I was preparing these slides, I was going back, I was trying to remember the first time I came across this report. And I actually saw that it had been posted by someone named Dr. Rochelle Walensky back in 2016. And this is the first time I had read about this report. And Dr. Walensky is actually now, as of January, our new CDC director. So she actually was the first person I saw that put this out. She was at the time a professor at Harvard Medical School, and now she leads the CDC for the United States. But she was the first person I saw that put out this idea that patients are safer when facilities work together. And this had inspired a lot of the work we had been doing in Orange County, which is we need to be in this together. We need to have collaboration between our hospitals, between our nursing homes, between our long-term care facilities, because, germs spread. And if one facility is not on board, then, we all have to be in this together. So this is just this concept that we had been aware of and been thinking about for a number of years. And I want to give you an example of how we had kind of used this approach, this idea that, healthcare facilities, that patients are safer when healthcare facilities are all on the same page and all working together towards a common goal. So I'm going to give you a few examples of the work we had been doing, at the time when coronavirus hit about a year, became a real big problem about a year ago. So we had been involved working with our nursing homes in our community on a number of what we call quality improvement programs and some different infection prevention clinical trials. And these really focused on two major activities. The first is this idea of bathing. And so, when patients are in a hospital or people are being cared for in a nursing home, you're already sick with, people are not at their optimum health. Oftentimes they may have, different types of devices or different catheters, things that are inserted into their body. So our goal was that, if you clean the outside of the body, if you focus on something like bathing, a bed bath that's being given or people being assisted with a shower, if we make sure the outside of the body is clean, that could be really important for preventing infection from diving inside of the body or causing what we call an invasive disease. So we had a number of projects. We had our Shield project, our Project Protect, our Project Clear, that all focused on this idea of improving the way that bathing care is delivered, working with nursing assistants, with the nursing leadership to provide training and education on really how to properly give a bed bath or how to give a shower. How do you, from head to toe, between the fingers and the toes, really breaking down the process of something that could feel intuitive. Many nurses, when we first approach, they say, I know how to do that already. But we really went in and we gave reminders about the important things. And I'm going to share a few examples from our Shield project and our success with that. But taking these basic hygiene principles and really breaking it down and providing a high level of training and education so that every bath, every shower is delivered with high quality care. And we're actually in progress of a separate project where we kind of took the same idea. This time we were looking at cleaning. So instead of cleaning patients, we're actually looking at cleaning the rooms and cleaning the environment in a hospital or in a nursing home. And with this project, we're working with housekeeping to really, again, take the process of cleaning, break it down into simple, step by step, and how can it be done in a high quality way every single time. So with these different types of projects and programs, we had established relationships with our nursing homes here in our community and had been working with them for a number of years when it comes to these different types of training activities and quality improvement campaigns. And I'll take a little bit of time to give you one example because it actually plays directly into how we came across our strategy for preventing COVID-19. So Shield Orange County, this was a CDC-funded public health collaboration, and it was led by investigators here at UC Irvine, Dr. Susan Huang and team. And this was a unique partnership because we had funding from CDC, which is, at the federal level. And then we had strong support from public health at both the state and local level. So we were supported by California Department of Public Health and also Orange County's Department of Public Health. And we would, have calls all together and really talk about our strategy for working together with the healthcare facilities here in our region. So this involved 35 facilities. We worked together with our acute care hospitals, the nursing homes, and also these long-term acute care facilities, which are oftentimes kind of chronic ventilator facilities where patients stay for a longer length of stay. And our goal was to enhance the amount of training when it comes to bathing and providing bathing care. And so what we did is we took, the process of giving a bed bath or the process of giving a shower, and we broke it down and provided really basic kind of protocols and information. We've made everything available online at our website at ucihealth.org. And we developed a relationship with these facilities and with the nursing home staff there to really empower them that, providing a really high quality bath and really taking care to pay attention to the details of providing bathing care could actually save lives. So this was a 25-month training program. It went from July 2017 into July 2019. And we're still working on finalizing our results, and we'll be submitting it to a medical journal later this year. But what I could tell you is that when we looked at the data, when it came to infections and before our program, and then we compared it to after we had implemented this program and looked at the nursing homes that were part of our Shield program and the nursing homes that were not, we found that this program resulted in significant reductions when it came to infections and hospitalizations among the nursing home residents. In other words, this high level of training when it came to giving bathing care actually prevented nursing home residents from having to be transferred to the hospital due to an infection. And we were really pleased with these results because basically we found that we were proving what our idea was with that patients are safer when facilities across the county all enhance their level of bathing at the same time together. And this actually got the attention of our local Medicaid, Medicare insurer, which is called CalOptima, because they noticed that after our program, they were actually saving millions of dollars when it came to infections in the nursing homes. And they were so impressed with this data that we collaborated together. And they actually, when our program ended in July 2019, they said, we want to help keep this going. We want to help support these nursing homes, continue to deliver this level of bathing care and provide them the training and education that they need. So they've actually, once our CDC funded in 2019, our Medicaid, Medicare insurer here in Orange County has helped keep the project going, help support us putting this onto a website, providing more training. And our team actually still continues to go out to work with nurse educators and to work with the nurses and the Medicaid program to continue implementation. And our SHIELD program only had 16 nursing homes participating, and now we're up to 30 out of the 70 nursing homes in our county participating. And we're hoping this continues to spread so that eventually all of the 70 nursing homes are part of this quality improvement initiative to improve bathing care and to continue to prevent infections. And I tell you all of this because it leads us up to how we became, how we were situated when the coronavirus pandemic hit. So basically, it was maybe about a year ago, around this time, that coronavirus is still very new, but we realized this is a very significant threat, and we needed to be prepared. So our team actually got 2 phone calls, I would say, within a few days of each other. One came from our the Department of Public Health here in Orange County, and the other came from our partners over at the Medicaid Medicare group. And they both called our team with the kind of same idea. They said, you have all this experience working with the nursing homes here in Orange County, and we are all really worried when it comes to COVID-19. How could we work together to do something to help the nursing homes? So it was kind of over a series of a few phone calls, and within 48 hours or so, we got launched as the Orange County Nursing Home Infection Prevention Team. And we called ourselves the Stop COVID Team. We, quickly came together to brainstorm to see what could be done for nursing homes here in Orange County. And so this team is led by Dr. Susan Huang. She also led that SHIELD Orange County project that I was previously speaking about, and her team here at UC Irvine. And this was with the support of Orange County Public Health and our Medicaid agencies. And we had 3 main goals when it came to addressing COVID-19 and providing support for nursing homes. Our first and foremost goal was to provide education. And I feel like with a lot of public health campaigns or public health challenges, providing information to the people that need it most is always priority 1. So that was our first goal, is to get information, training, and guidance out when it comes to infection prevention for COVID-19. So we, developed a number of materials, documents, and I'll show you some of the highlights of that. And we actually went out in person and did training sessions. And in the very beginning, a lot of our focus was to address the level of fear in these healthcare workers, making sure that nursing home employees had the information they needed to protect themselves so that they could safely care for these very vulnerable residents at the nursing home. So our first and foremost goal was to get that education and information out there. And I'll walk you through some of the examples of that. And then our second goal is, we learned this when we were working on our bathing projects and when we were working on cleaning, is that, you could have anything written out in a protocol, but that does not mean that it's going to be implemented and followed as it's written. So our goal was to not only get the information out there, but to really support these nursing homes to develop high fidelity practices to make sure that these protocols are being followed to protect their staff and to protect their residents. So this involved working with nursing leadership, to work with the managers, to make sure that we are reinforcing and reminding about the really key strategies. And there's a lot of staff turnover. There's always new people coming in and out. So to help maintain that level of training, and it requires a lot of reminders. And then our third activity that we did is we helped to support the logistics when it came to COVID surveillance testing. So that means, performing the nasal swabs on staff and on the residents, and to also more recently now support with the implementation of the vaccines. And I'll walk you through some of the highlights with each of these. But because of our existing partnership we had with our public health and with these Medicaid agencies from our previous projects, and because we had already, established this idea that facilities need to work together to have our best chance at protecting patients, this is kind of the mindset we had going into our COVID prevention program. So you may have heard or seen this in other places, but when it comes to infectious disease prevention, we often use what we call a Swiss cheese model. So you have all of these slices of cheese, and each slice represents a different prevention activity. So this could be something like wearing a mask, or doing hand hygiene, or keeping 6 feet distance. And what we know is that there's holes in the cheese. And what those holes in the cheese represent is mistakes or errors that might happen. Not every single step is implemented 100% perfectly. And because of that, our goal is to have several layers of prevention strategies to decrease the risk of the virus getting through all the holes in our cheese, and to help prevent transmission. So this is just a little analogy we use, but basically our layers of prevention strategies are listed out here. And these are very similar to just the common public health recommendations that we all hear about. So things like wearing a mask, cleaning your hands, social distancing. In the nursing homes, we had a big concern when it came to the break rooms, and this could hold true for other occupations as well. Why are the break rooms such an area of concern? Because people have to take off their mask to eat. And oftentimes these are tiny little rooms that, have 1 or 2 tables in there. And it's the only location where staff have that they could, heat up their lunch or take a drink of water. So I'll show you in some of our examples, we had a lot of focus on how staff could safely interact in the break room. We also had a lot of education, especially with the leadership, to encourage this idea of staying home when you're sick. Don't come to work if you're not feeling good, and encouraging the staff to speak up. So this actually was an activity that required a lot of reinforcement and reminding, along with this daily symptom screening, every day when people come to work, making sure that, they get their temperature checked, that they answer, the questions about symptoms, and same thing with the residents. And one thing we've learned in nursing homes is it's really hard to ask a nursing home resident, does your throat feel a little scratchy? Do you feel any different? It's not always possible to get an accurate patient history, especially when people might have dementia or different kinds of impairment that the signs and symptoms that someone else might feel, like a sore throat, or maybe they're feeling achy. We're not able to directly ask nursing home resident about that. And then lastly, doing routine testing all of the staff members, testing all of the residents in the nursing home for COVID on a regular basis. And then finally, and most recently, is rolling out the vaccine, and nursing home residents and the employees were included in that very first tier when it came to the priority list for distributing vaccines. So I'm going to walk through some examples of how we approached, implementation of each of these different strategies. And I think there's some lessons that we could all take away, because it doesn't just apply to nursing homes. These are the same exact strategies that we all are following in our, daily life. So one of the first things, that we focused on during training is how to properly wear a mask. For most of us, wearing a mask all day is not something we were used to. Even for healthcare workers, not used to having to wear a mask for hours and hours on end. So we wanted to make sure that for the nursing home employees to feel comfortable and safe performing their job every day, they needed to understand how they could protect themselves first. And so our main takeaway with this is, and I think this is probably familiar to many of us, in order for your mask to work, it has to cover your nose and mouth. And in the first several, training sessions we went out to, everyone would have a mask, but half the people's mask would be down under their chin. Some people would have their nose poking out. So we actually had one of our volunteers, put together this little infographic, showing this is the proper way to wear a mask, and it shouldn't be, down under your chin. Or we even had some people pull it up over their head. And another thing we tried to emphasize is, I don't know if any of you have been in a mask for a while and talking, your mask can slide down, and that's okay. It happens. But what we trained the staff is that if they needed to fix their mask or to pull it back up, it's really important to make sure that your hands are clean before you do so. So we broke down our guidance into really simple messages, making sure the mask covers the nose and mouth, to clean your hands every time you touch your mask. Another thing we taught is to take off your masks by the straps. Don't pull it from the front, because if you can imagine, if you're caring for a resident who could possibly, or you're caring for someone who's possibly in a COVID unit or could be contagious, you want to make sure you're protecting yourself every time you take on and off your mask. We also taught our staff that, when it's time for your break and it's time to take off your mask, to store it in a safe, clean space. And we're actually a really big fan of just a simple paper bag. This is where I have my mask right now. I always have it just on my desk next to me. Especially in the break rooms, we found people were putting their mask on the table or in their pocket or on their lap. So we worked with nursing homes to just get simple bags, simple safe place, designated place to keep the mask separate so that it's not getting contaminated. Or oftentimes in the break rooms, we don't know when that table was last cleaned off. So just giving the employees these really simple tools to protect themselves and to keep their mask clean throughout the day. The next thing we focused on was hand hygiene. And again, this applies to all of us. And it's one of those things that's really difficult to try to provide training on because it feels so intuitive. We all know how to wash our hands, or, we face the same thing when we were giving training on bathing and cleaning. But what we really emphasize at first, when we would go to the nursing home and we would observe the staff doing hand hygiene, and we would see a lot of this, just a simple rub of the palms, and then that's it. But what we really try to encourage is that in order to protect yourself, you really need to clean all of the surfaces of the hands. So let me see if I have my hand sanitizer here. And I'll just do a quick demonstration if you're able to see me on the camera. So I have my sanitizer in my hand. We rub our palms. It's also important to get the back of the hands, in between the fingers, the thumbs, the wrists even, and the fingertips. And by the time I rub all of those surfaces, I actually don't have too much left on my hand. So a lot of times we were just seeing people go like this, and then they have to air dry it because they have so much left over. When you really rub it in all of the surfaces, that's the best way to protect yourself. And this was especially important for healthcare workers who might be taking on and off gloves. That's why it's really important to get the wrists. But these simple things that, feel intuitive, we all have washed our hands for a long time, but these reminders become really important when it comes to, I guess you could think of minimizing the holes in our cheese of our prevention layers. We want to do it right every single time. And in healthcare, in a lot of places, hand sanitizer, like something like Purell, is the most convenient way. You have it on the wall. People might have it in their pocket. But in certain cases, it really is necessary to wash with soap and water. And we say that that's really necessary anytime the hands are visibly soiled. And in those cases, we advise staff to wash their hands for at least 20 seconds and to follow the same idea that they should really pay attention to covering all of the surfaces, thumbs, wrists, in between the fingers, and the fingertips. And what we did is actually we worked with the nursing home, the nurse managers, to help identify what we called hand hygiene champions of the week. And we give them little, we actually have these little pins that say COVID hero. And every week they would find the nurse or the nursing assistant, whoever really seems to be taking their time to do their hand hygiene, and they would get rewarded. And that kind of encourages everybody else to want to be acknowledged as a hand hygiene champion. So little things like this to just empower and encourage these behaviors. And a lot of times people get competitive. They say, oh, that person was the hand hygiene champion. I want to be the hand hygiene champion. And then everyone's taking their time to rub in their sanitizer. So that's the kind of behaviors we're hoping to encourage. Here are some pictures just to show you. This is back last May. We had gone out and done several in-services, with the staff. One, to just answer their questions. This is Dr. Huang, who is our team leader. And these are some of our project coordinators. We went out, we gave every nursing home employee their own mask. We gave them a bag to keep it in. And we also gave them each their own bottle of hand sanitizer. And here's a picture of the audience. We tried our best to, distance apart, but we really taught everybody to wear their mask properly, to how to clean their hands, how to take on and off their mask. And by the end of this 30-minute session, everybody kind of walked away with tools of how they could protect themselves so that they could perform their job and feel safe going to work every day. And a large part of this was just having an open discussion Q&A for the staff to ask their questions. And especially at the beginning, there was a lot of fear, a lot of concern. And by having, an infectious disease doctor come out and talk to them and give them that attention, we got a lot of feedback after those talks that it really made them feel more comfortable going to work every day. So this was one of the nursing homes we went out to. And then in addition to going out, so we did some in-person events, we did several online webinars for the leadership to attend, and we also created an online prevention toolkit, which is on our website at ucihealth.org, and it's called Stop COVID. And this has documents that are available to download. So this is for everybody. We created it for Orange County, but really any nursing home across the world can visit the website and look at these materials. And what we created was simple, roadmaps, A to Z. Where do you need to start from, for when it comes to COVID prevention? And then we also had some detailed protocols, how do you wear a mask? How do you put on protective gear? What should the visitor policy be? We also created some posters. We have lots of frequently asked questions, and we even filmed some videos with tutorials. And I'm going to highlight some different parts of the toolkit here, but it is all available on our website at UCI Health. And I think what this green arrow is pointing to is we had just come up with several new documents with information about the COVID vaccines. And I think we've even added some more since I took this screenshot. We have them now in English and in Spanish for staff to make it a bit more accessible. So these are some of the posters we created, just simple things that list out the symptoms of COVID. Especially these are the break room safety reminders, sitting 6 feet apart, cleaning the table before eating. Even having a simple spray bottle available on the table was a challenge for a lot of nursing homes. They were actually afraid of people stealing it, for example. So we had to work really closely with the leadership to make sure that the tools were there that were necessary so that people could protect themselves. And we even taught the staff that if your facility doesn't give you a spray bottle, you could just take a little bit of your own sanitizer, put it on a tissue, and wipe the table around you. And then we gave them the tools, store your mask in a clean bag and always cleaning your hands before and after you take on or take off your mask, and of course before eating. So we've made these, we actually made them into like poster clings. So it's like a giant sticker that peels off, and they could stick it on their walls and stick it on the bulletin boards. So we've made several posters. These are just some examples. We also filmed some videos. So this is Dr. Huang and I holding just a normal tape measure. I have one here in my drawer somewhere too. But we actually went out to the facilities, took out a tape measure and said, this is what 6 feet looks like. And just, another visual reminder of 6 feet keeps you safe. And we did the same thing with, created videos. How do you put on and take off your protective gear? And what gear is necessary when? So a lot of these nursing homes wound up having their own COVID unit. And so, they would wear gowns and face shield into those areas and gloves. So with Dr. Huang and some of our other infectious disease doctors, we actually got, a film crew out, and we filmed how do you put on and take off your gear. And we made these all available to the nursing homes for training. And okay, so I think I had mentioned a little bit of this. So that, we had covered some of our masking education, some of our hand hygiene education, reminders about the break room and 6 feet distance. One of our biggest challenges was actually these next two bullets here. when it came to, everyone arrives at work and they're asked, have you had X, Y, and Z symptoms in the past, day? Um, and it's actually, we realize people have a lot of pressure to work even if they're not feeling well. And especially for nursing home staff, oftentimes these employees might have 2 or 3 jobs, and they are really concerned about losing a day's worth of work when it comes to, income. So we had to do a lot of work, understanding, the barriers that might come up when it comes to asking people, have you had such and such symptom? And to really try to encourage this culture of safety that speaking up is important and speaking up can actually save lives. So we worked with the nursing leadership to really praise the staff that say, I don't feel so good, even if it's a slight scratchy throat, or, they might feel like they're feeling something very mild. That even those very mild symptoms could be super important to, report or to tell your supervisor to stay home that day. And this is one of the hardest things to try to encourage because people might not feel comfortable speaking up. So and even among the employees too, just to kind of encourage each other to speak up, stay accountable, and to stay home if you're not feeling well. And I'm actually doing interviews with the nursing home employees. I've been, to try to better understand what's from their perspective. And oftentimes they do admit, they're worried about, having to stay out of work, or if they, won't get paid for that time. So there's a lot of different pressures at play when it comes to, getting people to reliably not come to work if they're not feeling well. And then our most recent efforts have really focused on these last 2 activities, which is testing, performing surveillance testing of the residents and of the staff, and also helping with the rollout of the vaccine. So why is it important to screen the staff and residents for coronavirus? One is, as I mentioned, staff might be afraid to speak up if they're feeling sick, or they may not know about the symptoms. So we try, we provide education, training, and try to reinforce the importance of all of those things. But of course, if an employee comes to work and they receive a swab and they find out that they are positive, this is of course important because it allows the leadership to send them home and to help prevent them to further spread disease across the facility. And then in the residents, it's really important that we're performing these kind of routine tests because it allows us to understand, maybe they weren't showing the typical symptoms. A lot of times, like I said, it's hard to get an accurate history out of someone who might not be able to tell if their throat is feeling a little bit sore, or they're, feeling something different than the day before. So by doing testing, it allows us to separate the residents who do test positive and keep them, take them, if let's say they had a roommate, take them away from that roommate and help to prevent the spread between residents at the nursing home. And in Orange County, at least, we've implemented what we call like a red zone, a yellow zone, and a green zone, where the red zone would be people who are confirmed positive for COVID. The green zone is those who have tested negative. And the yellow zone is where people that were in the red zone, and after they've recovered and are no longer contagious, they kind of move to the yellow zone. And then after a certain amount of time, they're able to go back to the green zone. So breaking it down into, and then each different of those areas have, different gear that the healthcare workers have to wear. And it helps, again, just kind of break it down in a more simple way for the staff so that they know what they need to do to protect themselves. And then when it comes to the vaccine, so the nursing homes were, prioritized in that first tier of vaccine priority. And so why is it important to vaccinate? Well, one, public health experts understand that getting a high enough proportion of the population vaccinated is what is really needed to end this pandemic. And they estimate anywhere, I've seen numbers from 70 to up to 85% of the whole population should really be vaccinated in order to prevent this disease from continuing to spread. And so the vaccine, of course, is, we have 2 great vaccines available that provide 94 to 95% of protection against COVID-19. And as more and more people get vaccinated, this will help to prevent not only cases, but the deaths and the long-term effects of COVID infection. And as I've been interviewing nursing home employees, many of which, have been infected previously last spring, last summer, many of them are still not back at their 100% self. They'll still say that they're feeling fatigued or still feeling achy or feeling not back to their 100% usual self. So with an effective vaccine, we're able to prevent all of those different outcomes. And of course, that staggering number of deaths that we've seen in this population. Okay, so that just kind of wraps it up. Basically, for some challenges and future directions. So nursing homes are, of course, this high risk, very vulnerable population when it comes to poor outcomes due to infection and especially due to coronavirus. We've learned that in many instances, these facilities don't have the resources and training necessary to address infectious disease threats like coronavirus. And we've also come to understand a lot of challenges when it comes to staffing. We've noticed there's high level of turnover between employees, and there's, in my opinion, the staff there are not compensated. They don't get paid enough, and they have a lot of financial pressure, often working multiple jobs, and may not be willing to speak up if they're feeling sick because they have such pressure to work. And especially when compared to hospitals, infection prevention is a relatively new activity in nursing homes. And it wasn't until the fall of 2019 that nursing homes were required by Center for Medicaid and Medicare Services to have their own infection prevention team and have a designated person who's tracking, the infections in the facility. And this had been commonplace in hospitals for several years. So nursing homes are just now kind of turning the page and prioritizing infection prevention as an activity. So, for future directions, there's really this need for improved training, more regulation when it comes to infection prevention. And for me, I see that a goal is to build a culture of safety in these care facilities. So whether that's, taking care to give a bath properly, because that will protect from germs on the outside from entering inside of the body, or, cleaning a room really well, because that'll prevent germs from spreading from the person who is there to the person who will be there tomorrow, or all of these strategies from hand hygiene to wearing a mask to social distancing that are our main prevention strategies and the layers that we need when it comes to addressing COVID-19 and other infectious disease threats. So with that, I just thank you all for your time and for listening for me for this discussion. I really am appreciative to the Pulse group and PPS for inviting me to give this talk. And of course, grateful to my team at UC Irvine and our Stop COVID prevention team.